Hi, this clip is trying to show you how to mobilise or how to self-mobilise your patella. So this is usually for someone who's suffering from some kind of patellofemoral pain, and what we're looking at is just trying to move and stretch the kneecap a little bit. So what's useful, I'm just going to draw on my knee where my patella sits. This is optional, you don't have to do this at home, but it just can help to give you an idea of and orientate yourself to where your kneecap is. I'll do exactly what I tell my son not to do and draw on his legs. Here we go. So I don't know if you can see that too well. Let's just show that a bit better. So that's the outline of my kneecap. What we're aiming to do is often with this condition is your kneecap, instead of sitting nice and flat, can sometimes get tilted or sit in a slightly tilted position. And what that means is that you often get more pressure through one particular point at the back of your kneecap rather than spreading that stress all over the back of the joint, which then is less painful. So with most people's kneecaps, you often tend to find they get tilted down towards this top corner. Some will get tilted just the whole that outside edge, but most often it's this top inside corner which tends to get a little bit tilted down. So what we're going to try and do is tilt it the opposite way. So we're going to try and push it down and inwards whilst also tilting the kneecap. So the way to do that is we're going to take just the fleshy part at the base of your thumb. We're going to put that on the inside edge of your kneecap, and as we press down it should almost feel like you can feel this outside edge just lift up slightly. So we're going to keep that pressure on, so we're tilting the kneecap, and then we're trying to get our thumb on the outside top corner. Now you can do it with your thumbs if you feel that's okay, or sometimes using the other fleshy bit on the other hand, you can just make a good contact over the edge of that. I'm going to use my thumb just so you can see it a little bit easier. So we're going to tilt that kneecap down, we're going to apply pressure to that top corner, pushing in a downwards and inwards direction. And first of all what we're going to do is just take up any slack within the soft tissue. So you'll often find that you can glide your kneecap quite a way until you feel any restriction coming from the soft tissue. So we want to take up that slack to begin with by pushing the kneecap down and across, and then what we're going to do is just rocking it forwards and backwards at that end position. So you're not taking it all the way off and back each and every time. You tilt it, take up the soft tissue slack, and then it's just rocking it there at the end in the direction suggested by your physio. Doing that for a couple of minutes, doing it once a day, can just sometimes help to decrease the sensitivity through the back of your kneecap and help your kneecap sit in a bit of a more normal position. Okay, that's it.